Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, my dad in ICU has a fighting chance to survive, but the ICU team thinks otherwise, please help. You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer the next questions from one of my clients, Bob, as part of my one-on-one consulting and advocacy service. Bob's dad is critically ill in ICU, and Bob is asking why the ICU doctor is suggesting a withdrawal of treatment if he's saying that his job is to advocate for his dad. So today's question is, the ICU doctor says he's an advocate for my dad, so why is he suggesting a withdrawal of treatment now? You can also check out the last week's episode is part one, working with this client, and today is basically the second part that we publish and broadcast here today. So Bob writes, "Hi Patrick, thank you for putting this together. I've responded to a few things below. Based on the Glasgow Coma Scale rating, I'd say my dad is about a 6 out of 15, although he looks like he's trying to talk but can't make any sounds. I see his mouth and vulva move. Unknown for the ABGs, it was something that came up in rounds, and an IV drip was installed yesterday. They are doing routine suctioning of dad and provide daily counts over 24 hours. He had 9 suctions in the last 24 hours, 7 the day before and 5 on the 15th. Also, they think that the ventilator is pushing the secretions into the lungs, and when they trach cradle him, it brings them up. I don't think dad is getting any chest physical therapy. I'll ask, I wasn't aware this is a thing. To my knowledge, no cardiac consult has been put in. Yes, my dad has medication for blood pressure, norepinephrine via the IV drip, and an oral medication, midodrine, to use less norepinephrine. To prevent his heart from going into AFib, he is on amiodarone, which is administered orally. He's been getting bladder scans once a week. Unknown if any other tests are being done. He originally had some sodium bicarbonate given orally to try and improve kidneys, according to the doctor. Now that is given by IV starting yesterday. My dad is on an airbed and is being turned every 2 hours. I will inquire into those questions. My dad's skin in general looks pink and healthy. Agreed that there was negligence really, and we'll ask today about the cultures. I will ask what their treatment plan is. The white cell count was 20, next day was 20, then it was 17, and then 21 over the last 5 days. I was told that they don't want to mobilize, and because they want to keep the blood flowing to his vital organs, having him moved around moves too much blood away for the moment. That came from the head physiotherapist yesterday. Much appreciated, from Bob." So here is my response. "Hi Bob, I'm responding to your email. So you're saying that IV drip was installed yesterday. They're doing routine suction of your dad and provide daily counts over 24 hours. He had 9 suctions in the last 24 hours, 7 the day before and 5 on the 15th. You think that the ventilator is pushing the secretions into the lungs, and when they trach cradle him, it brings them up. You're probably right there. The ventilator is pushing down secretions, but that's why it's also important they do keep the regular suctioning, and they also need to start a regular nebulizer such as normal saline nebulizers. Could also be some Ventolin in the mix or Atrovent, but definitely nebulization to mobilize secretions. You're saying that you don't think your dad is getting chest physiotherapy. You weren't even aware that this was a thing. Well, he definitely will need chest physiotherapy daily. He would have lost a lot of muscle strength and muscle tone during this time in ICU, and he needs daily physical therapy or physiotherapy. You are saying that with the cardiac issues, AF or AFib and so forth, to your knowledge, no consult has been put in. Yes, your dad has medications for blood pressure, norepinephrine via IV drip and an oral medication midodrine to use less norepinephrine to prevent his heart from going AFib. He's on amiodarone, which is administered orally, so that's good. It sounds like they're doing all the right things in order to get norepinephrine down. Midodrine is a good drug to have, and with preventing AFib, amiodarone is the drug of choice. So that sounds to me like they're on the right track there. Bear in mind, one of the side effects of amiodarone can be kidney failure. You were also saying that your dad has been getting bladder scan once a week, unknown if other tests are being done. He's originally had some sodium bicarbonate given orally to try and improve kidneys according to the doctor. Now it's given by intravenous yesterday. Okay, well he's getting sodium bicarbonate intravenously. That's to be a different concern. I guess it depends on how much he's getting. With a bladder scan once a week, how much? How much are they scanning? Do you know how much urine is in his bladder after the bladder scan? That would be a good indication whether his kidneys are working or not. Then you're saying your dad is on an airbed and is being turned every 2 hours. You have to question that. You know whether he's got pressure sores. You're saying that your dad's skin in general looks pink and healthy and they mustn't neglect that. But please keep asking those questions, what they're doing in terms of pressure sores and pressure area care. The last thing your dad needs is another pressure sore. You said that white cell count, it was in the 20, 17, 17, 21 over the last 5 days. Normal white cell count is 4 to 11. So that is a sign of an infection. You should also ask for his temperature, obviously. You should also ask his CRP levels. You should ask how they're treating the high white cell count. Is he on IV antibiotics? Have they screened for an infection again? Are they treating the right source of infection to begin with? Also, next, mobilization. You were told on that they don't want to mobilize your dad because they want to keep his blood flowing to his vital organs. Having him moved around moves too much blood away for the moment, and that came from the head physiotherapist. Look, given that he's still on norepinephrine and some midodrine, they may have a point in not mobilizing him, but it really depends on how much norepinephrine he's on. If he's on high doses, absolutely no to mobilization. If he's on low doses, I'd say they can be very carefully mobilizing him, but very, very carefully. So I hope that helps, Bob. For now, let me know if you need anything else and we'll go from there. So Bob writes back, "Hi Patrick, another thing that raised my alarm bells really is regarding the medication that the creepy nurse said to my mum. She told her before I give her the medication, go look at Dad's face and see his face. You'd like to remember seeing him. She then went on this tirade speech about nothing is healing on my dad and nothing would ever heal. After objecting to the new medication, I asked my mum to go take a walk and talk to discuss this. As soon as we walked out of the room, the doctor appeared to start the family meeting. They sat us in a room and disappeared for 15 minutes. I told my mum it's a power play. I also discreetly recorded the conversation. They came in and gave a very doom and gloom thing about everything is much worse with Dad than it was when he initially was here 3 weeks ago. Suggested withdrawing support from Dad. He said his job was to advocate for my dad. I told him very firmly his job is to heal my dad and our job is to advocate for Dad. The doctor told us at how Dad's esophageal tissue was falling apart and that even with the stent they put in, Dad is too infected to heal. I challenged him on that. The CT scan done showed nothing was worse, and the other doctor said it may even be a bit better than the previous CT scan. They said the stent put in blocks things and they have no way of actually looking to verify. I asked the doctor and said, without a new CT scan, how do you know it's falling apart and not healing up? He didn't provide an answer and said there is no way I can look at it. I also raised my concerns to the doctor about the new medication and he implored it was just for pain management to make him comfortable and that they should try to see what happens. We were also told in the meeting how bad my dad's lung function is, that he couldn't get off the ventilator, but then asked about his Pseudomonas infection progress. I was told his lungs are now clear of secretions. He was breathing with 99% O2 today with minimal ventilator support. Regards from Bob. Hi Bob, so let's break this down a bit further step by step. The nurse or any of them is not in any position stating that your dad will not recover from anything. You can always say no if they're suggesting withdrawal of life support for your dad. They should not be controlling your decisions, neither are they in a position to, but rather control them with what you think is right for your dad. Intensive care teams, generally speaking, are overtly negative. They often paint a doom and gloom picture for families in intensive care. And if you don't know how to challenge that, and if you don't know how to ask the right questions, it's very difficult for you to get the outcomes that you want. And also, how come they told you that the esophageal tissues of your dad was falling apart when the results of the last CT scan showed nothing was worse and even better than the previous CT scan? The doctors should be explaining to you in full detail the results of any diagnostic studies for your dad. And how come the stent they put in your dad became too infected? Are they giving the correct antibiotics for your dad? Any referral to the infectious disease consultant? If so, what are their plans? What antibiotics for your dad is getting the right treatment for now? Is it given via IV or via tube? Have they done any blood or wound cultures in particular? What are the results? Getting anything too much infected would have been prevented if they have given your dad the correct antibiotics and if they have provided the correct clinical management for your dad. It is good to know that he has good oxygenation saturation with 99% with minimal ventilator support, but it is important as well to note that he needs to be negative of any bugs, Pseudomonas, if he became positive before. To know if he already is, they should have done a follow-up of tracheal culture change and repeat chest x-ray, and not just say from their observations that his lungs are now clear of secretions. That's not good enough. Getting off a ventilator takes a while, especially if your dad has been on sedation for quite a long time, and if he's still on it up till this time. There's going to be parameters to know if your dad is already ready for extubation or for the breathing tube to be removed, and he should have undergone a weaning process. Weaning means gradually reducing the support the ventilator is providing for your dad until minimal parameters have been reached so that your dad can breathe by himself. So it's important that he is out of any medication that would cause any respiratory depression. Other factors should be if your dad is awake and cooperative, adequate oxygenation, adequate ABG, arterial blood gas. An arterial blood gas test measures oxygen and carbon dioxide levels in your blood sitting up in bed and presence of spontaneous cough. I hope this helps. Still any questions further, please don't hesitate to ask. So, that concludes today's consulting and advocacy session with Bob. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to, in your free instant impact report, it will give you an in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of our website. Also, have a look at our ebook section where you can get more ebooks and videos. And you can also get one-on-one consulting and advocacy with me over the phone, via Zoom, via Skype and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.